Now we move on to the main part of today's program, Shaping the Future of Healthcare in India, a visionary panel dialogue. We are pleased to have distinguished panel for today's dialogue, who are the heads of prominent institutions and medical associations in India. Each of these leaders shoulder immense responsibility. We invite Father Ivan Santosh Dia, who serves as the National Secretary of CBCI, Commission of Health. Welcome, Father Santosh. Father Abraham, Director General of the Catholic Health Association of India. Welcome, Father Mathew Abraham. We invite Dr. Priya John, General Secretary of Christian Medical Association of India. Welcome, Dr. Priya John. We invite Forum of India. Welcome, Sister Blanch. We invite Dr. Sukumar Chitturi, General Secretary of Evangelical Medical Fellowship of India. Welcome, Dr. Chitturi. To moderate this panel dialogue and discussion, we invite Dr. Vinod Shah, who has served in various national and international responsibilities in the field of medicine and healthcare, and served as the former CEO of International Christian Medical and Dental Association. I now hand over the panel discussion to Dr. Vinod Shah.
It's a privilege to be able to moderate this session. We have some important questions. The first question will be answered by each of you, and then we are going to have a panel discussion on the second question. The first question is, what was the founding vision of your organization? What has been its impact, and what has been the achievements and the contribution in the years past? So, would I ask Father Santosh Das to go in first?
Yeah, thank you so much. Today, the Catholic Church in India has more than 3,500 healthcare institutions in all the states and union territories of the country, serving the sick people with care and support. We have 170 more dioceses in 14 regions. We have the networks, Catholic Health Association of India, Father Mathew is here, Catholic Mental Health Ministers of India, Sister Doctors Forum of India, Sister Dr. Blanch is here, and also the Catholic Nurses Guild, as well as social service societies of the different dioceses from a nation-wide network for healthcare. To be more effective and to be more focused on the healing ministry of the Church, the Catholic bishops of India established a commission for healthcare in the year 1989 with the objective that the Health Commission is to function as the coordinating body of all the health-related organizations and institutions in the Church in India. It is rooted on the realization of the importance of caring for the sick and to give preferential option for the poor and the marginalized. The key principles and goals aimed at enhancing healthcare services in India by CBCI Health Commission, particularly for the underprivileged and marginalized communities, are: first one is holistic approach to health, which emphasizes on addressing the physical, mental, social, and spiritual health, integrating them into the healthcare services. Second is healthcare for all, commitment to provide affordable and accessible healthcare to everyone with a focus on the poor and vulnerable populations. Third one, the quality care and ethical standards, ensuring high standards of care, maintaining ethical practices, and respecting human dignity in all the healthcare services. Fourth one, preventive and promotive healthcare, focus on prevention of diseases and promotion of healthy lifestyle through education and community programs. Fifth, community-based healthcare, encouragement of all the community participation and the establishment of community-based health programs to address local health needs. Sixth is collaboration and networking, building partnership with government, non-governmental organizations, and other stakeholders to enhance the reach and effectiveness of healthcare services. The seventh one is capacity building, investing in the training and development of healthcare professionals and workers to improve the quality healthcare delivery. Eighth is advocacy and policy influence, advocating for policies that support equitable and just healthcare systems and influence health-related policies at various levels. Ninth one is to sustainable health financing, promoting sustainable financing mechanisms for healthcare services to ensure long-term viability and reach. And the 10th one is research and development, encouraging research and innovation in healthcare to address emerging health challenges and improve service delivery. The healing ministry in the church speaks volumes about Christian dedication and commitment to serve the poor and the sick people. It is also worth noting that 85% of the healthcare facilities of the church, especially by the Catholic Church in India, are in the rural areas, caring for the marginalized in letter and in spirit. The church in India has responded generously and compassionately, making Christ present for others through her healing ministry. Following the example of Jesus' own actions, the Catholic community strives to break down the barriers of isolation felt by those who are sick or dying, to include them as full members of the human community, and to provide hope and ultimate healing from sin and death. Healthcare mission of the church is entrusted to us by Christ and is implemented by dioceses and religious congregations all over India through various institutional-based and community-based activities. Besides, there are thousands of Catholic healthcare professionals continue to live this mission today through their services. The Church in India, through its large healthcare network and the CBCI Commission for Healthcare, has a unique opportunity, and it has made use of this opportunity and has a potential to live out the mandate of Jesus to heal and to proclaim the good news. Thank you.
Thank you. We really want to celebrate the contribution made by the Catholic Church in India. I think we all know how much they have done in the rural areas in primary and secondary care especially, but also in tertiary care. But we will come back to this a little later when we are discussing questions 2 and 3. Can I ask Father Mathew from Chai to go in next?
Thank you, Dr. Vinod Shah. I'm really grateful for this opportunity, and I'm so happy to be here because I would say I was also part of the CMC Vellore journey. It's a fascinating story, story of Idaskada. I was fortunate to be in the Bahrain campus for 3 years as part of my post-graduation. So I have a lot of friends from the CMC network, and so happy to see you all. Well, Chai also has a fascinating story. It's a story of another woman called Mary Glory. She was an Australian. She came to India in 1920, and she decided to become a nun, a sister. She was a medical doctor, and after 20 years of work in India, in 1943, 16 sisters under the leadership of Sister Dr. Mary Glory, they started this organization called Chai. The original founding vision was to increase the quantity and quality of healthcare in India. And when they started, there was nothing, practically nothing, as the time of Ida Skada. Today, we know that the quantity and quality of healthcare in India has improved a lot. And many of the government systems also developed after that. Many of the trained professionals came from the nursing schools or colleges run by the Christian institutions. And we have a vision document. It's called Vision 2030, and the title is Compassionate, Affordable, and Quality Care at the Margins of the Society. That is what we exist for. It started as a small organization. Today, as Father Santosh said, we are a network of 3,500 member institutions. 80% of them are small health centers in, especially in remote parts of the country. We have about 600 hospitals in the network, ranging from 10 beds to 500 beds. Yeah, in our network, we have 5 medical colleges and 135 nursing colleges. And approximately about 21 million patients are being cared for. Unfortunately, we don't have real-time data. I wish we had it. So these are numbers based on some samples and projections. So we are Now we are trying to see how we can now get actual data from our network. So Chai is an NGO and also a network. So what I showed earlier is the numbers from the network. But Chai is also an NGO, and as an NGO, our focus is, we have some focus areas. We work in community health, palliative care, disability care, especially children with disability and children with HIV. On an average, every year, we reach out to about 6,000 children with disability, supporting them not only in healthcare, but education, social inclusion, and now for livelihood. We care for about 2,500 terminally ill patients through our partners, and about 1,500 children are cared with HIV are cared for. We in the NGO project we reach about 175 villages for community health, and these happens through donor funded projects. But since there's a limitation for funding, these are the numbers we directly reach. In addition to this, many of our member institutions, especially sisters, reach out to all these areas, but that is not being supported from Chai, the NGO. I think I'll stop for the time being. Thank you for this opportunity.
Thank you so much. It's really amazing that you have a network of thousands of members, so many health centers, medical colleges, and I just was wondering if all of us work together and able to pool our resources together, what an impact we can make on the country. But I think that discussion can wait a little later. Can I ask Dr. Priya John to go in next?
Thank you, Dr. Vinod Shah, and thank you to all the organizers of the Indian Christian Day. And also a warm greeting to each of our panelists as we look at working together. Yes, I represent the Christian Medical Association of India. It is a 119-year-old organization, and I'm just going to put up one slide to give you a quick snapshot of what we do as an organization. Okay. So as the Christian Medical Association of India, our primary object is the prevention and relief of human suffering and the pursuit of the measures for the promotion of health in the spirit of Christ, in the extending of the kingdom of God. This is what is written in our constitution. This is what is written and submitted to the government, and every government authority that comes to us for an inspection will look at this one sentence and see how all our activities, all that we've achieved over the last few years, how does it align to this one statement? I have bolded and highlighted some of the main words because those are the action words that we try and hold ourselves to when we plan our activities, when we make partnerships, when we propose any kind of project or make partnerships. Now, if this one sentence has been our objective and is the primary objective of CMAI, how do we achieve this? We are a membership organization, just like Father Mathew also talked about Chai, and we are a network. In the eyes of the law, we are an NGO. We have 275 member institutions as our members, and this constitutes mainly the Protestant and Orthodox hospitals and about 10,000 individual healthcare professionals, which includes the whole healthcare team, the doctor, the nurse, the allied health professional, the administrator, and the chaplain. Now, how do we achieve this object? These are some of the ways that we do it when we align our activities to ensure that we prevent human suffering as the best way we can. We promote health in the spirit of Christ for the extending of the kingdom of God. And when we talk about the kingdom of God, it's about kingdom values, that we ensure that we as an organization, we hold a mirror to ourselves before we try and build capacity among our members. We ensure that the values that each of them showcase is aligned with kingdom values, whether it is integrity, accountability, humility, honesty, trustworthiness, and many more that we hold ourselves accountable to. So primary healthcare is one, ethical healthcare services, which further broken down into value-based relevant care, health system strengthening, universal healthcare coverage, so that we contribute to what our country also wants to achieve. And we have been the pioneers in healthcare education, quality education, as well as capacity building of each of the individuals. So just to quickly showcase how what we have achieved as a network. I'm not putting up numbers because numbers, yes, they are important, but somewhere the identity of CMAI comes down to these few words, which I just want to highlight before I end. We are relationships. We are fellowships. And because of this relationship and fellowship, we have been able to come together as a network and build many mission hospitals, including CMC Vellore, through the decades when they were all first starting. This quality of ours, this unique strength of us as a network of being relational and being a fellowship has really played a key role over the last 119 years. Stepped in the gap of healthcare accessibility. Yes, I stand in front of archives dating from 1905, and each of them talk about areas where there was absolutely no healthcare and how these institutions, these hospitals, whether it was a one-bedded hospital, which slowly grew, they stepped in the healthcare, in the gap where there was absolutely no access to healthcare. Led the way in the care of the marginalized. We have already heard so many talks about that. In the previous session on the Hindi session, there was amazing talks related to this, the leprosy care, HIV, disability, and many more. Palliative care, all important areas where we looked after the marginalized. And of course, the caste system that really ruled and continues to be a burden in our country. We were pioneers in medical, nursing, and allied health education, and we continue that trend. And we hope and pray that the government will give us the recognition, even as they look at the new bills in nursing and allied health education. And of course, as CMAI, in our mission statement, we work with the church because 80% of our 275 mission hospitals are all owned by the church, and we are their technical partners in health and development. And the last but not the least is the whole talk about transformation. Yes, we have statistics to show how our mission hospitals, our network has contributed to improving healthcare indices in the country, whether it is in the empowered action group states or now aspirational districts. But more than that, how have we transformed ourselves to ensure that we provide care in the spirit of Christ? And in one of the archives I wrote, I have read that sometimes the way we may not cure a disease or bring about amazing changes in the healthcare indices, but just the fact that we do not shout at a patient and we do not lose our patience as healthcare professionals, that itself was a witness to the community we serve. And in the previous talk, we heard Dr. George Verghese talk about how we need to understand our communities. We need to love them, even if they're very different from us. And that is the first step of doing the work in the spirit of Christ. I will stop here and I will hand over back to Dr. Vinod Shah. Thank you.
Thank you so much, Dr. Priya. I really like what you said about relationship and fellowship. And I think if we have more of that, we probably would have had more impact. And also, I don't know whether you mentioned that CMI was accorded some parliamentary approval for the training. Well, that was some time ago.
For nurses, yes. Yes, sir. For nurses, yes. For 2 of our nursing boards, yes.
Okay, thank you so much. Next, I will ask Sister Dr. Blanch Rosario to go in.
Thank you, Dr. Vinod Shah. A pleasant evening to all of you distinguished panelists, organizers of this event, and every enthusiastic participant who generously puts the other before their own needs and comforts. The passion and zeal of Sister Dr. Mary Glory is alive in the persons and mission of Sister Doctors who, with a choice to remain on the peripheries, minding not the long and grueling working hours, with no available substitute in many of our workplaces, inspiring society with undaunting spirits, playing significant roles in our own institutions, in the congregations, the religious congregations and the church at large, the relevant, promising, and well appreciated presence of Sister Doctors in this land of ours is truly an asset. Why? Because we go above and beyond our call of duty to serve some of our country's most vulnerable and hard to reach communities. As the country continues being innovative in creating sustainable well-being societies, committing to achieve equitable health now and for future generations without breaching ecological limits, every Sister Doctor rendering needy and compassionate service puts in her maximum effort to comfort, assist, and instruct the needy sick with a holistic approach and provide health services. True to its founding vision in bringing holistic healing towards fullness of life by following the mandate of Jesus Christ, the divine healer, and fostering fellowship and solidarity among its members, Sister Doctors Forum of India, since its inception in 1993, has taken giant steps to become what it is today. True, the wisdom and experienced guidance of passionate, dynamic, innovative, and selfless leaders of this forum will always be worth remembering, and Sister Doctors Forum of India will continue to be indebted to every voice that has moderated this unique association. About 750 Sister Doctors registered with our forum, belonging to nearly 104 congregations, are a unique group with dual identity. Why do I say dual identity? Because we are both religious and qualified professionals, holding basic and specialization degrees in different branches of medicine. We provide preventive, curative, promotive, and palliative care service, especially in the rural and tribal areas of our country. And for better coordination, our forum is divided into 8 regions: Northern, Eastern, Central, Western, Andhra Pradesh and Telangana, Karnataka, Tamil Nadu, and Kerala. And what do we actually do? Over the last 3 decades, since its inception in 1993, SDFI has significantly contributed in organizing capacity building training programs for its members and continuous medical education programs. And we also participate in community health and development activities through collective projects at the regional and national levels, like Save the Girl Child Campaign, anemia control and treatment camps, mother and child welfare programs. We did this from 2010 to 2016. We involved ourselves in prevention and early detection of cancer in women through awareness and screening programs nationwide from 2017 to 2023. And now, from 2023, we are engaged in early detection of lifestyle diseases through both awareness and screening programs. Alert and ready, the Sister Doctors have been in the forefront during natural calamities like earthquakes, floods, tsunami, COVID pandemic, and even during communal rights situations like the
Okay, thank you so much. That was very inspirational to know that there were 1,000 sister doctors and they are all connected in the Sisters Doctor Forum of India. Even I had not heard about them till very recently, and I think more people need to know about this forum. And it's a very innovative idea to have a dual identity. Thank you so much. Can I ask Dr. Sukumar Chitturi of the EMFI to go in next.
Thank you, Dr. Vinod Shah, and good evening, panelists and all of our friends. So, greetings from Evangelical Medical Fellowship of India. We were part of UESI, Union of Evangelical Students of India, from the beginning. Around 1974, some of the students of Nagpur Medical College, they met then the General Secretary of UESI, that's Reverend Chandrapilla, and they presented the needs of the doctors and dentists. Their idea was the needs of the doctors and dentists were different. So they need to be a separate fellowship for the doctors and dentists. So in 1974, a fellowship was formed for the doctors and dentists in the country. And thus EMFI was formed in 1974. And around that time in 1971, some of the doctors, they left their practice and they joined the student ministries. And we were followers of Jesus Christ from the field of medicine and dentistry, drawn into a fellowship of his purposes in healthcare. We seek to be a voice witnessing to Christ through the whole person care, ethics, pro-poorness, and advocacy for missions. So EMFI was formed, and Reverend Chandrapilla was a pioneer in that, and we had Dr. MC Mathew as the founding secretary, and Dr. Namboodiripad was the first chairman, and Dr. Nankliana was the traveling secretary that time, and Dr. Kurulajaj was the full-time general secretary, and even Dr. Shah, he was instrumental in EMFI ministry all these years. And over the years, Dr. Kurula Varghese, Dr. Varghese Philip, Vinod Shah, and Dr. Sushil Tharin, Sam David, Manoj Jacob, Dr. Sam Siddharth, and many other leaders, they spent their important years, prime years of their life for the ministry of EMFI. And we are the followers of Christ, and we are part of the International Christian Medical and Dental Association, that's called ICMDA. And our vision is to see Christ transforming presence in healthcare and the nation through Christ-centered medical professionals. So our focus area is Christ-centered medical professionals and the presence of Christians and the Christ transforming presence in the healthcare in the country. And we have a focus groups. Our focus groups are medical and dental students, and missions and EMFI. Missions is our first love, and we also work among the doctors in the missions, and we work among the practitioners in the private sector and doctors in the government sector. And these are our key focus areas: missions, discipleship, evangelism, ethics, poor and marginalized. So we nurture our students, we nurture our graduates, and the doctors, professionals in all these areas of focus. And we do this through person care, that is through personal mentoring, nurturing, and we do some need-based initiatives, that is missions like Institute of Medical Missions. It's a virtual institute through which we train the young doctors for the medical missions. And we do discipleship programs, evangelistic camps, and sessions on ethics through the Center for Bioethics in New Delhi. And we facilitate some of the programs so that proper networking can be built up among the stakeholders of the healthcare, so that society at large can be blessed. And we do marriage and enrichment seminars, Kingdom of God conferences, whole person care, and Saline is one important program which we do through the IHS Global, that is International Health Services. And we also do conduct some of the leadership programs in various parts of the country. And EMFI fellowship is our functional unit. We have the students fellowship and the graduate fellowship. For this, we have open homes across the country, and which are being run by these graduate couples. So there will be a fellowship caretaker couple, and there will be mentors who will be in that nearby vicinity of some of the graduates who would be helping these students. So the students will be meeting in this open home at a periodic intervals, and they'll share the Lord's word, and they'll study the application of Bible through the scriptures for their medical practice, and also the challenges they discuss, and some of the counselings and the learnings can be made there. And we have working each one of these states where the fellowships are placed. So this is one functional unit for us, and we have the graduate fellowships in various parts of the country. So EMFI, we have 19 staff placed in different parts of the country. We have 3,000 plus graduate doctors in our network. And we never numbered them. I'm just giving you the rough figures. And we have 250 fellowships and graduate fellowships across the country, and we have 500 plus graduate volunteers. What are these graduate volunteers? These graduate volunteers they'll be willing to work for the students ministry. They'll be work for the hospitals whenever there's a need, and they'll be working for the needs of the students and the hospitals at large, while taking care of their professional work at their workplace. And we have committed graduate mentors for various fellowships across the country. And we're working in 27 states currently. And EMFI, over the last 50 years, we're celebrating our 50th year of God's faithfulness. And over the last 50 years, EMFI had sent hundreds of doctors to sing medical missions in the country. And over the last 50 years, EMFI supported Indian medical missions through the doctors. We nurtured and mentored doctors in the EMFI fellowships when they were students. We have done pioneering work in medical missions in the country and other domains of healthcare. Domains of healthcare, they were started growing after 1990s when the corporate started growing. That's when we started working among the doctors who are working in government, who are working in the private sector, who are working in individual practice. Now we have become more inclusive and in our approach to include more doctors into our work. These are our partners, and we have collaborations with Prime in palliative care, IHS Global in saline. We are a partner organization in ICMD. So these are some of the elite organizations in the country with whom we are working with. And the challenges, yes, we need more mentors and mission-minded doctors. These are the number of medical colleges. So EMFI's vision is to see one fellowship in every medical college and one mentor couple in every medical college. So we need more resources and more people to help the medical students so that
the challenges
we can reach out. Yes, sir. So we can reach out to more medical students. So thank you very much. Over to Dr. Shah.
Thank you so much, Dr. Sukumar. I can testify to the fact that over a 50-year period, thousands and thousands of doctors have become leaders, they have become servants, and they have helped Christian institutions grow and blossom. And because mentoring and developing leadership cannot easily be measured, it is difficult to produce numbers. But I can tell you, just because from a panoramic view, that it has had a huge impact. Thank you. We will now move on seamlessly to the next session. And in the next session, we will go in the same order. And the question is, what are the future challenges and how do you expect or how do you plan to address those challenges? Father Santosh Dias.
Yeah, just as the CBCI Commission for Healthcare networks with all the other networks in the Catholic Church, and as well as when I really travel all over the place and in the country in different regions and in different dioceses, what I find is always one of the biggest challenges that the healthcare institutions always tell is the inadequate material and human resource. One is that growing cost of the drugs and consumables. It is like when our healthcare centers are mostly considered as need to be the charitable way it has to function. People expect lots of free offers and subsidized cost and all that. It is very hard and difficult sometimes for most of the health centers when the cost is also growing, the expenses are more. At the same time, also to serve these poor and the needy patients. In many of the health centers of ours are in very remote areas and not able to adopt the technology in the in the health centers. High technology is considered as a mark of high quality care also. At the same time, also to adopt this technology in the healthcare still in many places is a big difficulty and a big challenge. In some of the healthcare care centers, like it's a commercialized healthcare driven by market values today. Therefore, to keep up the noble values like respect to life, practicing the ethical model, ethical medical practices to make it, a regard for the human dignity, and also to give empathetic service in healthcare is the biggest challenge. Many times these are overlooked, not considered. Their biggest challenges that the healthcare centers are also facing. What I also find is that the church in India, the Christians especially, as we have, all of us have shared now, we are, as it is said, a big network. If we are put together or we work together, it's a second after the government, we say most often. But at the same time, we do not have a core team in the national level where we are able to sit with the government and sit with them for policy planning and for analysis, for assessment and all. At the same time, also to be the spokesperson from the point of view of the church in India. We have not grown into that level still, we feel. Or we may say we have grown, but we have not identified and we have not somewhere says, we have come down saying that this is the core team that speaks for the Christians in India with the government or in different forums. Or we are not able to represent really and say it.
You've highlighted two very important challenges. One is the cost of drugs and cost of technology, and the other is the inability to talk to the government, advocacy. And thank you so much for that. I'd request the others to build on what has already been said if you're talking about the same thing. Otherwise, you can introduce new challenges. Father Mathew?
All right, I will look at challenges from two perspectives. One is an external set of challenges and some internal set of challenges. The external challenges includes increasing regulations that make it difficult, especially for charitable work, and also running hospitals. It's not easy. There is also this unscrupulous commercialization that is happening. And when money is considered as the highest value, money is a value, but when money is considered as the highest value, you look at patients now as an opportunity to make some more extra money. So, and in that process, the highly commercialized healthcare network takes away the best doctors, the best nurses, all the resources, and also even patients who have paying capacity. We followed, especially the charitable network followed a principle called cross-subsidization. It took from people who could pay and subsidized for those who could not. But now it is becoming increasingly difficult. Internal challenges includes, I would say, governance issues, leadership issues, also managing institutions professionally, funding, financial resources. All those are internal challenges. Some of these challenges we can handle. Some of these challenges are way beyond our abilities. So whatever we can handle, we try to handle through capacity building or trying to collaborate, network, and try to raise resources from different sources. I would stop there.
Thank you. So you have highlighted two challenges. One is the challenges from without, which includes regulations, which make it more difficult. And of course, the good old challenges from within, which is governance and professionalism. Thank you for that. Dr. Priya?
So as CMAI, we are looking at a Grow with CMAI initiative. We're looking at the symbolism of a tree. We're looking at roots, which dig deep. And what are we digging deep into? We're looking at the Spirit of Christ. We're looking at biblical foundations. We're looking at kingdom values. The tree itself, the trunk, as it grows, are we looking towards the right kind of light, the kind of nutrition? Are we growing in the right direction? Are we then finally producing the fruit and the shade, which is not for us, it is for others? Are we able to network? Are we able to help others as a fellowship and build a relationship where we actually showcase the fruit that is there for all to partake of and also to benefit from? So in that regard, looking at the roots, the main challenges that we're looking at today are governance related issues, land ownership, the way the governing body functions in any mission hospital. So some of these we have done a survey over the last in 2023 and in 2024. So I just want to say thank you to all the mission hospitals who have really given us their time in filling up these questionnaires. But these are some of the results I just want to project as a challenge. So we asked the question, is there a clear policy and commitment by the oversight body? As I mentioned, the church is the owner. So do they have a proper document which outlines what is their role as governance and what is the role as management? So 94% said yes. Now that is it's a positive step. But some areas, there are challenges which we as CMA are trying to address through a team, whether using legal professionals, we're looking at members of boards who are owners of the land issues, things like that, bringing in the National Council of Churches in India, trying to have a platform of discussion to address any of these issues related to how this oversight body looks at the hospital. The next question was related to diversity in a governing body, because a Harvard study did say that the more diverse your governing board is in terms of bringing in different experts, the better it is. 81% said yes. So there are different experts from different areas. Evaluation of the hospital done by some external expert in the last 5 years, only 51%. Do you have financial auditing mechanism apart from the statutory auditing? Because if you're saying Spirit of Christ, if you're looking at kingdom values, we have to be accountable, especially in finance related matters. And here only 50% of our hospitals have that. Is the mission vision statement clearly disseminated to all the staff? Yes, it is disseminated by 93%. Ownership of that is the next question, but that is something that we as CMI are working on. Land owned by, there are different ownerships. One is by the church itself, one is by a trust formed by the church, one is by the hospital itself, and it can be a gift or a lease. But in many of these areas, the challenge is that the lease is getting over, and what are the steps being taken? So in these areas, in these challenges is where CMI is trying to make some headway, working with hospitals region-wise, because state to state, there are different laws related to all these issues. So looking at human resource, without the people, there is no institution. We did a study for about 900 healthcare professionals. And when I say healthcare professionals, it is all the 5 members of the healthcare team. All they wanted, why they stay on in a mission hospital, is because of a healthy work, a friendly environment, of faith, which is their own personal conviction. They are faced with challenging work, which inspires them and motivates them every day. There is an opportunity to do something meaningful, and there is personal and professional development worked into their systems, especially the HR systems. So what are the areas to be? You want me to stop? Yeah, just this is the last table, because this is based on a study done in 1998 to looking at sustainable hospitals versus at-risk hospitals. And these are some of the areas which have to be addressed. And that is what we do as CMI: good administration and good systems, understanding of the mission and vision by the leadership and also by the staff, understanding leadership role and mentorship role, and also the personal calling and conviction. And in all these areas, what are the non-negotiables and how we can address them is what we as CMI are committed to doing for this year and for the next few years. Thank you, sir.
Thank you. Sister Dr. Blanch.
In addition to the challenges already mentioned with regard to the regulatory and policy environment, which include like increased regulations, policy changes, financial constraints, looking at funding issues, sustainability of the institutions, and technological advance, I would like to highlight that for our organization, the main challenges would be human resource challenge, like staff retention and recruitment, looking at their training and development, and also the competition from the private sector. There's a lot of private healthcare expansion, cost competitiveness, and one more challenge is limited resources. And our institutions itself, like many of our institutions have stood for more than decades, which need definitely renovation, which need investment in technology and recent technology. So I stop here in addition to the challenges already mentioned.
Thank you so much. So you've highlighted human resource challenge, the challenge from the privatization of health, and what else was that? What was the third one, sister?
Infrastructure and resource limitations.
Infrastructure, yes. Okay. Dr. Sukumar, this human resource may be of some interest to you.
So the challenges for EMFI, we need mentors and mentor couples for the medical colleges, 1,000-odd medical colleges in the country. And we also need mission-minded doctors and role models in every domain, that is in health, in corporate and government, and even in the private sector. I was going through an article today morning. 80% of the public healthcare is substandard. That's what the article says. We need role models in every domain, and we also need staff to cater these needs, the needs of each one of these fellowships and the doctors. We need resources at various levels, and we also need training modalities and tech-enabled platforms to meet the needs of the current generation, because the needs are changing. And the challenges, mentors, we are presenting the needs to the graduates to take up the responsibility of mentoring the fellowships. Capacity building, EMFI is collaborating with various national and international organizations to bring in capacity building measures. And we are shifting our activities to a neutral venues. There are challenges in the college campuses due to some of the ideological beliefs among the students. So we are shifting our activities to neutral venues outside the campuses. That's one of the challenges we are facing these days. And we also need role models in healthcare for the students in the academic institutions, so that they can grow while looking at them and at the college level, and they can be nurtured by the role models. And awareness of the healthcare needs of the country. We are encouraging the medical students to take up the mission trips to various hospitals across the country, and through the mission hospital support and the CMI network and EHA network. And we're also encouraging them to attend the conferences accordingly. And we're focusing on marginalized groups through mission trips, and some of the doctors are working in the marginalized and among the marginalized groups in the country. Another big challenge is the healthcare. The whole person care is a big challenge today in the healthcare. So the focus is being now whole person care, and we are nurturing the doctors from at various levels on whole person care. The needs of the students and the doctors, they're very challenging, ranging from emotional needs, studies, habits, and peer pressure. So we are collaborating with various organizations to meet these needs. Thank you, sir.
Thank you very much. I just want to highlight some of the challenges all of you have highlighted. One was the advocacy, and I think that is extremely important. Father Santosh Dias had flagged that, but Priya John has mentioned that there is such a thing as Christian Coalition for Health, which has been set up expressly to be able to do advocacy. I don't know if you're aware of that, Father Santosh.
Yes.
Yeah, I'm aware of it because through Chai, we were really much participating in it. In that, I think in the recent days or in the last 1 or 2, 3 years, I think we are not much doing through that.
Okay, but I think that's a body that needs to be shored up so that we can speak with one voice. About human resource, I think all of us have to put our heads together and have a strategy. Resource generation is also a challenge. I think we have been depending on outside resources for far too long. Maybe we need to look at resource from within the country. And I think governance issues and issues within the hospitals itself was also highlighted. And I think more training and more mentoring may be one solution. But I'm sure we have not been able to discuss all of this fully. But because of the lack of time, we may have to just close here. But if any of you have just one or two comments to make, please feel free to.
Dr. Vinod Shah, can I just come in with one more challenge, which I forgot? See, to sustain as a leader is very, very challenging, especially when there are a lot of constraints. There's we go through a lot of difficulty, and then tiredness, burnout. All these are also, we experience all that among our leaders. The sustaining oneself as a leader in healthcare itself is a huge challenge, I would say. Thank you.
Thank you. Any last comments? Sister Dr.
Sir, can I?
Sukumar. Yeah.
Yeah, thank you for hosting this event. You could bring in all of us together, and I feel there's a need to collaborate and work among the stakeholders for a bigger purpose.
Yes. What Priya mentioned, relationship and fellowship needs to be bigger, not confined to some groups. Yes. Yes.
Yeah, I just wanted to say, I think because this special day which brought us together, Indian Christian Day, and I feel that, see, within the Catholic Church, we have different networks. We come together, and in different networks, all they come together. We work together also. But I think I strongly recommend, or I would suggest to every one of us that whether we could find some ways and means or some forum where we all come together, all the networks, Christian networks in India together. And we do not know what we are going to come out of that. But certainly it is what we are seeing, many suggestions in the chat box it's coming, is that whether all of you could work together.
I think this is the most important takeaway from this meeting, that we all should form a forum where we can put our heads together and strategize together. Thank you so much for that, Father Santosh.
Yeah.
Can I hand this over to Dr. Abhijit?
Thank you so much, Dr. Vinod Shah, and the distinguished panelists here who shared about the challenges and the vision for the future.
Indian Christian Day, Yeshu Bhakti Divas. Love, serve and celebrate.